And now we can begin.
Excellent. Hi, everyone. My name is Melinda Hull, and I am one of the leaders on the workforce development team at MaineHealth. I oversee pre-apprenticeship and some apprenticeship programs, as well as our career navigation program at MaineHealth. And I am joined today by my lovely colleague, Laura Bennett. And so I'll let her introduce herself, and then we'll dive into the slides.
Thanks, Melinda. Hi, everyone. My name is Laura Bennett. I'm the program lead at the Center for Workforce Development, and a lot of my work revolves around youth programs and events. I run our non-clinical summer internship program for undergraduate and graduate students. So anyone post-secondary school, we have a number of opportunities for high schoolers that I know that all of you might be interested in. So more to come on that later. But I'm really excited to be here with Melinda to share more about opportunities.
Yes, as Laura said, we're very excited to talk to you about a range of careers and training opportunities, focusing on entry-level opportunities across MaineHealth. So I'll give you a little bit of a background about MaineHealth. Some of you may have heard of us before. Certainly those of you in the Portland area, Southern Maine region would be familiar with a couple of our hospitals, namely Maine Medical Center, Southern Maine Healthcare, and also Spring Harbor Hospital too. But we have over 22,000 employees, which we affectionately call care team members because they are part of extended care teams that help ensure that our communities are the healthiest in America. And so we, across our system, we have 12 hospitals in Maine and New Hampshire. Though we are called MaineHealth, we do have health system in New Hampshire, in North Conway. We also have physician practices across the communities that we serve. We have long-term care, senior services. We have behavioral and mental health networks across our system. We also have a not-for-profit home health agency. So we are more than just hospitals. And to that, we also are a laboratory. So if any of you have ever had a blood draw at Nordics, that is a MaineHealth facility. And so if you have an interest in lab work, you may want to join our laboratory that we have. We do have some accolades. We're one of among the nation's top 100 integrated health networks, and we happen to be the largest employer in the state of Maine. So basically what I'm saying is we have lots of opportunities for you. So here we have listed some of the entry-level roles. So these are roles that individuals can apply to and go into with a high school diploma or a GED, as well as meeting any of the other sort of specific job requirements. Many of these roles that you see here have what we would term on-the-job training. So you don't have to have any formal training to be hired for these roles. And in fact, part of the role does entail getting trained in the role itself. So you'll be trained on the job to do everything that you need to do in many of these roles. And so you can see we have anything from working in the anesthesia setting to the operating room to sterile processing, sterile supply, to administrative, to we have cafeterias and dare I say restaurant-like spaces on site at some of our locations. So if you're interested in culinary or perhaps food security or logistics, we have those types of roles too. So anything that you could possibly be interested in doing, we likely have an opportunity for you. So these are just a sample of the roles, many of which you can go into without any formal training. We also have nursing education pathways and pathways to work at MaineHealth. So for those of you who are interested in a nursing career, there are kind of a couple different ways to acquire the education for that career. after high school. One is an associate's degree and one is a bachelor's degree. MaineHealth hires associate's degree level nurses as well as bachelor's degree level nurses. The associate's degree is one which we encourage folks to take a close look at because it's a 2-year program only. And after one semester, you can actually start working as a certified nursing assistant at MaineHealth. So that's kind of a key aspect of attending an associate's degree nursing program. And given all of the incentives, scholarships, discounts available now at the community college, that is a very, very attractive and affordable option. And like I said, it affords you the opportunity to work as a certified nursing assistant after one semester of schooling. And then, of course, if you're interested in going on to a bachelor's degree, that's where it'll be a little bit of a longer program. After 1 year, you can register to be a CNA, assuming that you're not already a CNA. And of course, the tuition costs are a bit higher there. But we do have opportunities to enter the nursing profession and the work world at MaineHealth for both associate's degree and bachelor's degree nurses. Continuation of that. So if you're interested in pursuing a nursing training program, and this is if you are definitely sure you'd like to be a nurse, we have several training programs that we partner with around the state. Beale University, the Maine Community College system, which I just mentioned is a very attractive and affordable option. St. Joseph's College, University of Maine at Augusta, University of New England, University of New Hampshire, and University of Southern Maine. We actually have a dedicated team who would love to chat with you about your nursing plans. And so on this slide, you'll see there is an email address offered. It's nursingacademicaffairs@mainehealth.org. And they'd be happy to talk to you about these particular training programs and pathways to employment at MaineHealth as a nurse.
And we also have other training opportunities into 4 other areas. So Melinda kind of touched on some of these, but I'm going to walk through what that looks like. So, Melinda said that Nordex is a part of our health system, and we have labs across the state. A phlebotomist is someone who draws blood. So, if you're at the doctor's office, sometimes they send your blood for tests. So you go get a test tube drawn, and then they send it off to the lab, sometimes in the hospital. I know a lot of patients in the ER, you get a blood draw as soon as you go in to kind of help figure out what's going on. So that's sort of the different settings that you work in as a phlebotomist. The program itself is a 6-week program, and you earn the wage shown on the screen here as you're training. So you're a paid employee while you're training and going through these programs, which is awesome. And then once you become a certified phlebotomist or medical lab assistant is another term and title for that, your wage increases from that $17 wage to the $19 wage. Another avenue is our medical assistant training or apprenticeship. It looks different depending on the location. We've listed the Southern Maine rates and program information here. So it's a 9-month program, and medical assistants are the people who are helping you in the doctor's office. So they're seeing you before your physician comes in, before your doctor comes in. They're taking your vitals. They're asking you questions. They're taking notes. They're checking your blood pressure. So this is a lot of patient interaction in the outpatient setting. So it's not in the hospital. It's in more of the health clinics and the doctor's offices. And you can see the starting and increased wages reflective of once you become a certified medical assistant there. A certified nursing assistant, or a CNA, you'll oftentimes hear that called that for short. It's an 8-week program, and this is pretty similar to a medical assistant. It's just in that hospital setting. So other types of things that you would be doing in addition to what I mentioned with medical assistants might be, delivering food, helping patients who, maybe they need to go for a walk or maybe they would like to go outside. So it's a little more of that caregiver role in addition to those basic responsibilities and needs. And again, those rates are reflective of Maine medical centers in particular. So it does vary by location for our CNA program as well. And then lastly, we have the School of Surgical Technology. This is for anybody who is interested in surgery and being in the room in the OR, kind of where everything is happening. A lot of times, surgical technologists are support staff for our surgeons, so making sure all of the instruments are cleaned and sterile and lined up in the way that they need to be, depending on the procedure, and then assisting with the surgery as it's happening. So this is a 2-year program, and currently the starting wage is $19 an hour while you're training, and that increases to $25.24 after becoming a certified surgical technologist. All of these programs have different starting periods depending on the training. So we kind of outlined, what the time commitment looks like. But if you're interested in learning more specifically about when the next training opportunity is coming up, you can scan that QR code in the top corner, and we can also provide some information to Amanda afterwards. But basically, that'll link you to an interest form where you can express which of the 4 programs that we outlined here that you're interested in learning more about. Maybe there's a couple that you're comparing against, and that's totally fine. We just want to know kind of what you're interested in, where do you live, what location you're at, so we can pair you best with our facilities. And then from there, we'll help you figure out the program that best meets your interests and your needs, and hopefully get you rolling.
So Laura mentioned something very interesting there. If you are in perhaps comparing a couple of training programs, you're in a little bit of an exploration process. You're not necessarily looking for a job right at this very minute, but you do want to kind of understand more about some of these options. We have something that you could be very interested in. We have a clinical healthcare career awareness pre-apprenticeship. And it is designed for people who are looking to explore a clinical healthcare career. It's an unpaid, free training program, and it's delivered in conjunction with Southern Maine Community College. And it is actually hosted on the Southern Maine Community College's Brightspace online platform. So it is a completely online, self-paced experience, and you explore what it means to be a part of a clinical healthcare system and a clinical healthcare team, as well as really focusing in on virtual job shadows with a phlebotomist, a medical assistant, and a certified nursing assistant. So if you are interested in getting an up close and personal but virtual view of what a phlebotomist, medical assistant, and certified nursing assistant does, I definitely encourage you to check out the pre-apprenticeship. You'll also be exposed to concepts like medical terminology, patient care, workplace communication, study skills, public health, compliance considerations, and a bit more. So there is some career assessment, career interest assessment work that you do, and you'll get information on clinical and non-clinical pathways that align with your interests. As you go through the program, there are a few points of, or a few assignments or points where you can request advice and counsel from our career navigators. So the career navigator will get your assignment or your request in the course and reach out to you to talk to you about your career interests. And that could be one of these programs, or the surgical technology program, or it could be another role entirely. So this is a way again, for you to explore the idea of getting involved in a clinical healthcare setting as a clinician, and in particular, a phlebotomist, medical assistant, or certified nursing assistant. And then also to kind of have someone discuss those options a little bit more with you, and try to match you with the best fit for where you can see yourself entering the profession and maybe going long term.
So if you are not quite ready yet to jump into any of the things that we've spoken about up until now, I think some of these programs might be a good place to start, just as you're learning and trying to decide kind of what your interests are. So the first thing I wanted to share was our Inside Medicine program. This is a completely virtual program specifically for high school students, and it's open to everybody around the entire state of Maine. So right now it's taking place. We started in October and our cohort meets once a month. So from October and through March, we're meeting once a month, and we have a physician who leads the sessions in conjunction with Tufts University medical students. And each week, each month, there's a different topic. And, sometimes we're talking about ER cases this month. Next month, we're talking about surgery. So each session kind of has a topic, and from there, you dive into specific scenarios. So there's speakers who will kind of share more about their background, how they got into medicine, but then there's also time for the Tufts University med students to break out into groups. And in those small groups, they work with the high school students, you all as participants, to understand kind of a patient case. So they'll bring an example and say, this person came into the ER, this was their symptoms, this is what we were hearing them tell us as they were sharing about their experience. And from there, as a participant, you get to decide, what tests are we going to run on this patient? What questions should we ask them so we can gather the right information that we need in order to properly diagnose them? So it really is, it says mystery medical cases. It really is kind of a role-playing situation where you get to help identify a solution to a problem for a patient who's come in, and they use real life examples, and sometimes there's videos. And last month I think we talked about surgery, and we had a med student kind of step back and show us how to put on her sterile gown and her gloves and how to scrub up, how they wash their arms before surgery. So it was really, really interesting. And even though it's virtual, it's very hands-on and it's very engaging. And we have over 100 students participating currently. So there is not really a capacity. Um, so if you're interested at all, we really encourage you to sign up. We have sessions, like I said, that take place during the school year and then another during the summer. We don't have those summer dates yet, but if you're interested, there's more information on our website and you can learn more about when the registration will open up and join us, hopefully. And then next, I wanted to share more about our career exploration events. These happen on a semi-regular basis. We're working on making this a more regular occurring opportunity, but depending on the situation and the opportunity, it can be virtual or in person. And it's just another way, similarly to what we're doing today, we're sharing more about these different opportunities, but it might feature some different guest speakers from departments across the system, both clinical and non-clinical, just giving you just any sort of idea on what a day in the life of a specific position might look like. And so if you're interested in learning more about any of our upcoming events, I would highly recommend that you join our talent network, which leads me to our last point. We have an early career talent network, and that is a fancy way of saying an email list. But if you're interested at all in anything that Melinda and I have shared today, we really encourage you to sign up. This is kind of our direct line of communication with you all. I know that we do a really great job of partnering with so many different people across the state and with high schools and with different community organizations. But if you want to hear it straight from us, I think that's a really great way and a quick way for you to learn more about opportunities in healthcare and more specifically at MaineHealth. So you can sign up today. There is another QR code. We went a little heavy on the QR codes, I will admit. So if you're interested in learning more about any of these opportunities, I encourage you to scan that and sign up. And with that, we're going to list all the QR codes at once. But does anybody have any questions for us? I know we kind of zipped through that a little bit, but we're happy to open the floor up and answer any questions.
While people are thinking and typing their questions, I just want to say that was phenomenal. I thought I knew about your all the Earn While You Learn and training programs and career exploration, but I clearly did not. So thank you. That was excellent. I do have a question. What if you have somebody who's interested, a young person who's interested in non-clinical types of uh, jobs, like sort of more behind the scenes type things, billing, coding, clerical, what opportunities are there for this type of person for, entry level or for, training?
So I'll say that pretty much anything you're interested in, we have a spot for you at MaineHealth. We travel around the state talking to folks just like you who might say, I'm really into art and design, and I really like creating beautiful, materials for people to look at. Well, we have an award-winning marketing department that creates a variety of different types of informational materials, advertising materials, things to help patients understand what they need to do to help themselves get better, training manuals for physicians, for people like me. We have folks who help us create, who work in our communications department, who help us create beautiful, presentations to deliver to national audiences. So if you're creative, we have a spot for you. We also have, if you like to act, we have a spot for you. For instance, there's something called, oh, Laura, you're going to have to refresh me. It's a simulated patient. That might not be the exact word, but
At the sim lab, yeah.
yes. So when our med students and our other trainees need to basically role play case studies and what they would do in a clinical setting, we have folks who become simulated patients. They act, they use their acting skills, they learn a script, they act out, someone who's having, a particular medical issue, and they are a huge part in helping those med students become proficient, med students, nurses, whoever it may be, become proficient in their jobs. And so if you're interested in joining the theater, but you'd like to perhaps join MaineHealth instead, you can be an actor at MaineHealth even. If you have an interest in perhaps interacting with patients, but not necessarily in a clinical manner. Of course, when you walk into a doctor's office, there is usually a lovely, attendant who meets you, who greets you, and gets you all checked in and makes sure that the information is up to date. They might help you with any other questions or paperwork that you have. Those are patient service representatives. That's an entry-level role that you can go into, and it's on-the-job training there as well. And you get to utilize computer skills, customer service. You get to interact with the care team members, physicians, nurses, medical assistants. You're really an important part of the patient experience. You're the first person they see when they walk in the door. You can also do that same type of role behind the scenes. So we have people who perhaps work in medical records or billing as Amanda mentioned. Also, if you're interested in math and finance and accounting, we have a lot of roles there too, because think of it, we're a big, huge business. We have lots of bills and we collect a fair amount of money too. So we have all sorts of different types of areas where you can do financial analysis. We have what we would term kind of financial case managers that help patients figure out how to get funding for some of the procedures that they might need to have. And so discussing the different financial coverage options, helping them work on a budget. I could go on and on. If you're interested in mental health, behavioral health, being a social worker, being a teacher, MaineHealth has schools at our sites. We run a K through 12 school at our Center for Autism and Developmental Disorders. We run a preschool there as well. In addition, we have a school at Spring Harbor called Spring Harbor Academy, where we employ ed techs, behavioral techs, and teachers. So we also employ a teacher at the Barbara Bush Children's Hospital as well. So really, if you're interested in being a chef or a teacher or a doctor or a nurse or an administrative assistant or an executive, we have a spot for you.
Melinda, I got a couple questions here in the chat. One is, what is the wage for patient service reps?
That's a good question. It will be, and Laura, you may know, I don't know off the top of my head, but it's comparable to our CNA and phlebotomy level, I believe. So you start out at that type of level. So I'm going to say between $17 and $19 an hour. This is a guess, but Laura, you correct me. And then depending on where you go from there, there are wage increases as you go along.
Thanks, Melinda. I have another question. If you move to another state, would you be able to still use your credentials that you earned?
So I can jump in. So it depends. So medical licensure does vary from state to state. And so Maine has in some areas very rigorous credentialing compared to other states. And in some other states, there may be more rigorous credentialing than what we offer here. But that's something that so that's called portability is the name of what that looks like. And so for our MAs, we have MAs who work in Maine and we have MAs who work in New Hampshire. Even the ones who are living and working in New Hampshire join at times a Maine-based medical assistant training program. So the preparation might be similar. Sometimes those other states require a national certification or perhaps not. Maine requires medical assistant certification. Other states don't necessarily. So it does vary from state to state. It doesn't mean that you wouldn't be able to still work as a medical assistant or a certified nursing assistant. You just have to make sure that you follow the guidelines for all the certification submissions and proof of licensure and proof of education to that home state's regulatory board that will oversee that particular profession. So that's just a long, complicated way of saying it depends, but don't let that deter you because there is a lot of portability in these credentials.
Does anyone else have any questions? You can enter them, type them into the Q&A or the chat. You can also use the reaction button to raise your hand, and then I can unmute you if you'd like to verbally give your question. And while you're doing that, um, if you could talk a little more about um, clerical positions that are maybe if there's remote positions, or maybe not remote, but maybe in the office, in billing, or in medical coding or something like that. That seems to be there's a strong interest in people who want to they want to work on a computer. They feel comfortable on computers. They have they're bringing that skill with them, you know. What do you suggest for somebody like that?
Yeah, absolutely. I'll take this one, Melinda. We do have a pretty decently large billing and medical coding team. I know that if you're interested in learning more, you can email us at the workforce development inbox because we can connect you to the professionals who actually do that work so that they can share kind of a little more about what that day to day looks like. But I think they do have some entry level positions. So likely once you graduate from high school, you can start on their team in one of those roles and then kind of move from there. But we do have a ton of positions that are computer based. We have HR support staff that work through inquiries that come either by phone or by chat, and so that person is really just looking to link together. If somebody comes in with a question, they're sending that out to the right person to answer that question and to connect them together. We have people that work in administrative capacities. So Melinda mentioned an administrative assistant role. We have a ton of directors, vice presidents, executive leaders who have that office support staff. So, kind of serving in that administrative role, helping to manage the office needs and helping to schedule appointments and answer phone calls, answer questions from folks. I think if you're interested in any of these types of pathways, I think looking at our customer service and PSR roles, our patient service representative roles, like Melinda said, the people that are kind of at the front gates of any of our locations, any of our doctor's offices. So they're kind of the first in command whenever you walk in, and they're at the computer and ready to help answer any questions there. Um, I think, you know, in HR and in the corporate side of things as well, there's a lot of computer-based work. So we're in the workforce development team, and talent acquisition is our kind of neighbor department, and they work on the computer and they meet with candidates and they help with the hiring process. So if you're a people person and you're really outgoing and you're really social and you like to talk, I think that's something that is definitely a opportunity. And we, again, if you have any specific questions or if you ever want to talk to somebody that's in one of these positions, we're a big system, so hopefully we're able to connect the dots. I know it can be difficult sometimes to track down the right person, but Melinda and I and a couple of our teammates are very happy to be the ones to help direct you to those folks. And I know specifically, Amanda, in coding and billing, we have done that before. So if there's something that you're specifically interested in and you want to learn more, just shoot us an email and we'd be happy to connect you to some people so you can speak with them directly.
The other thing that I would add is if you go to our careers at MaineHealth.org website and you type in a keyword of remote, you'll pull up the range of remote roles that we have available. And again, as Laura mentioned, a lot of them are in medical coding and billing, customer service, data entry. So there's a variety of different types of roles that are remote as well. I would say we have more in-person roles than remote roles generally, but more and more as the offices evolve, there are more and more remote opportunities every day.
And a lot of our positions are hybrid too. So like Melinda and I'm in the office today, but Melinda's at home today. We all kind of, depending on our roles, we're able to operate in that capacity. So that's just something to keep in mind too. We're pretty flexible.
And we have another question. We have a couple other questions. The next one is, could you share more about food service types of positions?
Go for it, Laura.
Yeah, I was gonna say I'm happy to take this one too, Melinda. So yeah, I mean, I think Melinda mentioned this earlier. A lot of our larger hospitals have cafeterias. Maine Medical Center has a cafeteria and a coffee shop. So there's two separate spaces where we have chefs and food service workers who are preparing food and serving food. A lot of our long-term care facilities have more of that kind of restaurant style setup that Melinda was talking about. So, whether it's setting up a buffet or like, people coming in and you're ordering food and then you're making it on the spot. I think it's really kind of unique to each location. But we do have opportunities in food services, and a lot of those positions are very easy for high school students to be hired into just because the schedules work really well with after school scheduling. So if you're interested in learning more about part-time or per diem work in food services, we'd be happy to link up with a recruiter who can share more about our current opportunities. In most cases, we do have food service opportunities throughout all of our regions. So in the coastal region, in the southern Maine region, and then also in the mountain region. And then with that, I think it's important to note that even though some of the food service roles are entry level positions, there are positions and there's pathways through for food services that can lead to leadership roles. So there's food service managers, we have head chefs, first cook. We have a lot of different ways for you to kind of rise the ranks as far as food services goes. And then, if you go through food services and you're really enjoying it and maybe you want to shift into more of an office setting from there, we have supply chain and things like that that kind of lead into more of the administrative side of things. So really, and I think that's something that MaineHealth does a really good job of, is we try to make sure we're actually hosting an internal event next week for our care team members to learn more about different types of opportunities within the health system. So at any point throughout your career at MaineHealth, if you're interested in learning more about something else and you want to transition your career in a different way, Melinda mentioned before, we have everything here because healthcare has every sort of thing under the sun that you can think of. So we want to make sure that you're finding meaningful work that is important to you and that you're good at. And so at any point throughout your career, if you decide that you change your mind and you want to do something else, we're happy to help you figure out what that is and what that looks like.
Thank you. And so we have another question that came in about, are these apprenticeships only for youth? Are they available to individuals who are older? So I think it would be good if we can kind of clarify. I know it's a little bit confusing. There's apprenticeship, there's a earn while you learn, which kind of looks like apprenticeship, and then there's internships and training, right? So if you
Yeah.
can, get into that a little bit.
Yeah, so we actually, particularly in our MA program, we have people who we have brand new, folks who are brand new to the workforce. So they're just coming out of high school, or maybe they're early 20s. And this is their first foray, their first job. We also have folks who are career changers. So maybe they're mid-career professionals and they've decided that they really are interested in clinical healthcare. And so they join one of our training programs. We also have a cadre of retirees who have completed a long time career. They've retired, but they would like to continue to stay active, and they are vital in the workforce. And so they also join our training programs or even our entry level roles and get on the job training as something to do in retirement, full time sometimes, part time other times, and then sort of per diem, which is they pick up some shifts here and there as they have availability. So when you're speaking about apprenticeships and training programs, those are open to all ages, and we get all ages.
Thanks. So to clarify, the MA program, the medical assistant program, is a registered apprenticeship, and we've talked about a lot of different things, but the medical assistant apprenticeship program is the only registered apprenticeship program with MaineHealth at this point. So the other programs, the phlebotomy, the CNA program, the other ones that were discussed are, thank you, and the pre-apprenticeship, those are different programs. This is all right. Am I correct? They're all earn while you learn. So you're working, you're getting paid, and you're getting free training, right?
Correct.
Right. So that's the difference. One of the differences with a registered apprenticeship, like the medical assistant program, would be you get a certificate of completion from the Department of Labor on top of your credentials. So that's only with the medical assistant apprenticeship that you would get that. There's a couple other differences, but I'd say that's one of the bigger ones. Did anyone else have any questions about, oh, we got something coming in. Okay, it's been very informative. Thank you. Did anyone else have any questions about MaineHealth, about trainings at MaineHealth, positions at MaineHealth? I think this is an great opportunity to ask. We got someone who raised their hand. Hang on. I think they put their hand down.
I was
That's
gonna
okay.
say, I have something while we're waiting for another question, that I wanted to mention that's specifically for high school students. So Maine Medical Center has a junior volunteers program, and some of you might be familiar with this program. It is for those who are aged 14 to 17. Once you turn 18, you kind of just go into the regular volunteers program. So 18-year-olds are also, I guess, accepted, but it's geared towards high school students, and it really is a good way if you are interested in healthcare and you want to learn more about what it's like to be in the hospital setting. This program was kind of revitalized in the last few months. So it used to just be a summer program, but now they have opportunities throughout the entire year. And you can really work with the volunteer services team to figure out which type of scheduling and which area you're interested in volunteering with. So it's not a paid opportunity, but I think it's a good way to jumpstart your interest if you know that you want to go into medicine or if you're interested in healthcare. Um, in addition to, some of the programs that we mentioned, this is a really great opportunity to build those skills and to be in that environment, because I think a lot of times it can be helpful when you have that experience on your resume when you're going into even a training program or an apprenticeship program. If you're applying for an internship, or if you're going into you decide you want to go to college and you have a specific interest in a healthcare field, I think having that on your resume is really helpful, and just to have that background experience of being in a hospital setting and kind of working and volunteering in that environment. So we can send Amanda that information so you have a link to the website for the MMC Junior Volunteer Program. But that's another thing that I wanted to make sure that I mentioned, because it's a great opportunity. And now that it's year round, it's more accessible for everybody.
Thank you. So we talked about a lot of different things. That was a lot of information. But there's not going to be a quiz. You're not going to have to memorize it. We have it all, and we can reshare this. I can connect you with MaineHealth if you want to reach out to me directly, just so that they don't get inundated with requests. And I can help find the right person for you to reach to get more information. I just put my email in the chat, so you should have that. And I am happy to talk with anybody about apprenticeship, about I can connect you with MaineHealth and any other organization that's, even if it's not apprenticeship, I'm here to be helpful. So were there any more questions? Okay. Um, so you do have my contact, and I can share the, is it okay if I share the presentation? Okay, great.
Absolutely, yeah.
I can share that with everybody who was on the webinar today, so that you do have that information. You can review it again. You can uh, um, click on those what are they called? The codes to look at more information on those Earn While You Learn programs and the high school programs. It's very exciting.
Well, thank you very much, Amanda and the team and everyone for attending. It was great to be able to spend this time with you, and we look forward to further communication. Give us a call, drop Amanda a line, whatever you feel like talking about in terms of careers, we'd be happy to discuss with you.
Thank you so much, Melinda and Laura. Like, I'm so pleased that you could be here today to talk about MaineHealth. Have a great evening, everybody.
Thank you.
Bye-bye.